Hello, everyone. Welcome to Nurses Notes 101. The topic I'm going over now is cardiogenic shock. Cardiogenic shock is also known as cardiac shock. It is caused by the inability of the heart to pump, um, making blood insufficiently sent to the rest of the body. So the body winds up not meeting its metabolic demands due to the heart's failure to pump adequately. The clinical manifestations of cardiogenic shock is low cardiac output because the heart's failing, inadequate intravascular volume, that's supposed to be inadequate there, hypotension due to a lack of adequate blood flow, and tachycardia due to the heart working very hard. Common side effects of cardiogenic shock include impaired ventilation and perfusion. So these are all different ways that we can see this phenomenon happening. So if a patient has crackles, if their skin is pale and blue or they have cyanosis, if they are hypercapnic or retaining CO2, if they have low oxygen levels, and if they have an abnormal or fast respiration rate. Also, changes in level of consciousness can tell us that their heart is not pumping adequately and they're not getting adequate blood flow. Risk factors for a patient in developing cardiogenic shock include heart attacks or myocardial infarctions, cardiomyopathies, dysrhythmias, stenotic valves or narrow valves that prevent blood from flowing adequately, massive pulmonary embolisms, which can result in shunting of blood, post-cardiac surgery or cardiac tamponade. So cardiac tamponade would cause excess pressure in the chest and on the heart itself, which will decrease its cardiac output and cause a cardiogenic shock response. The key nursing assessments for us in a patient who has cardiogenic shock are these in my eyes. So it's going to be assessing level of consciousness. If you walk into the room and know that the patient seems to be more lethargic, not as responsive, or disoriented, that's a cause for concern in someone who has cardiogenic shock. You want to auscultate the lungs. We'll do this assessment at least every 4 hours, so we want to see if their lungs are getting any worse, any increased crackles or wheezing. This could mean the heart failure is worsening. We want to also assess their skin and extremities for perfusion and cyanosis, so looking at the color, feeling the temperature of their skin, and noting if they have capillary refill. We also want to monitor their vital signs, most importantly their pulse oximeter. If their oxygen level is seeming to trend low, that can be a cause for concern. And we want to monitor their arterial blood gases, looking especially at the CO2, if the pH is normal, if they're being compensated, and their oxygen levels as well. The most common nursing diagnoses for cardiogenic shock patients would be impaired gas exchange, either due from shunting or perfusion issues, or ventilation issues, decreased cardiac output, ineffective tissue perfusion, or fluid volume status. So patients who are in cardiogenic shock are going to have an increased fluid volume due to the decreased heart pump. They're going to have a buildup of fluid just like a patient in congestive heart failure. So our first line of treatment for everything is medications. If medications don't work, then we have devices. If devices don't work, we have surgery. So medications, and well, for all the treatments for one, focus on treating the underlying cause. So let's say the cause of this patient's cardiogenic shock is a massive clot. We could give them TPA to dissolve that clot. Cardiogenic shock patients are also at risk of developing future clots, so a lot of times they'll be on anti-clotting agents like heparin or Plavix. Patients with cardiogenic shock have that decreased heart pump, correct? So we would like to give them inotropic agents such as dobutamine, dopamine, or Levophed. These medications are positive inotropes. Positive inotropes assist the heart in pumping, which will help to assist these patients and increase their cardiac output. We could also give these patients nitroglycerin. Nitroglycerin is a vasodilator, a potent vasodilator, which, while it does drop blood pressure, it will help push blood along by dilating blood vessels. Let's say we give these medications, but the patient's still in cardiogenic shock, they're hypotensive, they have low cardiac output. The physician can think about putting in a device. So, a device helps to give the heart time to recover while assisting the heart to pump. The devices that we most commonly see and the three that we use are intra-aortic balloon pump, an Impella, and an ECMO device or an extracorporeal membrane oxygenation system. Depending on the severity of a patient's cardiogenic shock, they could either put in a balloon pump or go as far as to put an ECMO cannulation in. An ECMO cannulation and that machine is one that is used kind of like dialysis, but it's for the heart. So this machine does the complete work of the heart and it helps to push the blood from one part of the body to the other and oxygenate it as well. The intra-aortic balloon pump is a device that helps to reperfuse the coronary arteries, and it also assists in increasing cardiac output, while the Impella is another assistive device that has a motor actually, and it helps to propel the blood through the left ventricle into the systemic circulation. A lot of times, these three devices are bridges to a surgical intervention. So, if someone's on ECMO, they're probably pending a surgery once they're stable enough, or an LVAD, or actually a heart transplant, depending how severe this shock is and what damage has been done to the heart. Surgical interventions that can occur are cabbages or coronary artery bypass grafts, which create new routes of blood flow by developing collateral circulation, or PCI procedures can be done to open block arteries. This is a question about a patient who would have cardiogenic shock. So let's say you're a novice nurse. We want to note worsening symptoms for a patient with cardiogenic shock. Which symptoms listed here would highlight that the patient's shock is worsening? So it's select all that apply. The cardiac index of this patient is 3.5. The BP is 90/48. Their urinary output's 15 mLs an hour, and their wedge pressure is 35 millimeters of mercury. So looking here, it's just a question on if you know the normal values or not. So give yourself a couple of minutes, and on the next slide, we'll see what the answer is. So looking at this question here, it's apparent that the urinary output is definitely low. The blood pressure is low, which means that treatment modality that's currently happening for this patient isn't effective. And their wedge pressure is high, which means that the heart is working very hard to provide the current cardiac output that it's given. The reason the cardiac index is not a sign of worsening disease process is because that cardiac index is actually normal. That's it, and thank you for watching Nurses Notes 101. Please like and subscribe to my channel.